Hi, good evening. My name is Vanessa Aguirre, and I will be doing a business review of a pediatric oncology outpatient clinic. The pediatric oncology outpatient clinic will be located in San Antonio, Texas, where the population is currently 2,454,000. Within San Antonio, there are currently 4 clinics that are associated with pediatric hematology and oncology specialists. You might ask who will work at this clinic. There will be 2 PNPs, 1 medical assistant, 1 office business manager, and 1 secretary that will also work the front desk area. This clinic will serve all pediatric patients, including the patients who are following a pediatric oncology protocol that are over 18 years of age. This is very common in the cancer diagnosis of pre-beat ALL. Our team. We will have our secretary that will also work the front desk area. She will be in charge of scheduling and greeting our patients upon arrival. You will have 2 PNPs that work hand in hand to see the patients and collaborate with the physician. You will have 1 business manager that will handle all the finances and expenses for the clinic. And then you will also have 1 medical assistant that will be getting vitals upon arrival and doing everything within their scope of practice. Now we have our employment contract. We have 2 contracts, one for NPs strictly and one for our general employees. Specifically for our NPs, they will have 50-50 ownership of the clinic. They must abide by the Texas State of Nursing Scope of Practice guidelines. Their hours will be Monday through Friday, 9 to 5, with alternating weekends and holiday on-call shifts. And then one incentive of working at our clinic would be that their malpractice insurance is included in the clinic expenses. The last thing that I really want to point out for our NP contract is that departing APRNs cannot compete with the practice. This is due to sometimes NPs may have a disagreement, or an NP might want to further their career goals and have their own clinic of a different type. All of those are perfectly okay. However, we don't want that departing APRN to take any of our patients with them by offering better things. So we are putting it in our contract that they cannot compete with each other. And then for our general employees, hours 9 to 5, Monday through Friday, no weekends or major holiday shifts. That's like the dream time for everybody to work. You will get 5 sick days a year, excluding emergency situations. We understand life happens, things come up, kids get sick, so we will not use that against you. Scrubs and closed-toed shoes will be the dress code for everybody in the clinic. Benefits will be offered, so dental, vision, medical, life insurance, 401k, those will all be provided to our employees. And then the one incentive that we give our employees are that upon hiring, they get 1 month of PTO, and then from there, 5 hours are earned every pay period. The last thing that we would want all of our employees to know would be that they must be familiar with all procedures and services offered, and they must know which APRN is on call on the weekends and on holidays. This is for scheduling needs, really, and for helping the clinic run smoothly. Next, we have our collaborative agreement. This will be between the physician and the NP. Because in Texas, NPs must have a written agreement with a collaborating physician to prescribe medications. Within this agreement, it has to include all limitations that are put on for prescription authority. And then NPs still must apply for a DEA number. This does not eliminate that. Within this physician and NP agreement, the physician will have to be available to meet up with the NP once a month for consultations and reviewing patient care provided. This is so that everybody is on the same page and nobody is left out, and that the patient is getting the best care possible. Obviously, physicians get very busy and NPs get very busy, so we want to make sure that the NP has a backup physician in case their primary physician is not available. And that kind of goes hand in hand with the next thing, which is including the ways of communication. I know oftentimes physicians are in a patient's room, or maybe they're in surgery, or maybe they're on vacation. We want to make sure that in that agreement we list how we will be communicating. Whether that be text, call, page, email, you name it, we want to make sure that that is put into that agreement. At our clinic, there will be a lot of things offered, but I'm going to name a few. One would be the medical histories and physical exams. We always want to check our patients head to toe. We will provide counseling because oftentimes oncology patients have a higher rate of depression. due to a change in lifestyle very rapidly and for prolonged hospitalization. Many factors fall into that category. We will be prescribing medications as needed. We perform bone marrow biopsies and then ordering and interpreting labs. All oncology patients usually get CBCs because hemoglobin and platelets are oftentimes low, so we want to make sure that we're interpreting labs and getting blood products as needed. Next, we have our assessments and evaluations. So for evaluating our clinic as a whole, there are some things that we want to look at. One would be patient surveys. We want to offer a survey to every patient to fill out online after they leave. We will look at our coworker evaluations at 6 months and then yearly to make sure that we are working at a healthy environment. We will do monthly reviews of chart and referrals with our collaborating physician to ensure that we have all of our charting up to date and the physician feels like all of things are running smoothly. And we will also look at productivity. For example, how many patients are we seeing after 6 months versus after 1 year? Are they going up? Are they going down? We want to make sure we look at that productivity. From those assessments, we will look at making adjustments on the way NPs show patient care. If the survey showed that the NP was very inconsiderate or the NP was very fast, we want to take all of those into account and make sure that we're talking about it and showing that we can change the way we do patient care. We also want to make changes to the practice if needed, such as physical things. If they don't like the smell or they don't like the location of the parking garage, we can try to make physical changes. Not guaranteed, but we can try. And then next, we can see how the employees are feeling and make changes to their contract if needed. If they feel like they want to work less hours or they're working too much overtime, we can look at all of those things and look in the contract and make sure that we are abiding by those rules as well. So to become an APRN, there are some steps, especially if you want to open up your own clinic. So first would be you have to graduate from an approved Doctor of Nursing program and specialize in the pediatric nurse practitioner track. From there, you will pass a national board certification exam specific to your specialty. For our clinic, we would want you to have a PPCNP board certified. Third, you have to obtain any certification specific to your business. For our clinic, it will be a chemo certification and basic life support. Next, you will have a collaboration with a physician within your specialty, including a prescription authority agreement. You want to have a physician already in mind that can collaborate with you so that when you open up your own clinic, you will have that component. And then the last step, the best step would be to start working with the second PNP and begin opening up a clinic for oncology patients. The fifth one is your goal, but you have to do all first 4 steps to make it happen. In Texas, an annual salary for our NPs would be $117,890. It comes out to about $56.68 an hour, with the average cost of a clinic visit being about $100. However, you get a lot of payments back from Medicare. They pay 85% of it, Medicaid 100%, and third parties such as Blue Cross Blue Shield will pay 85% of the bills. When it comes to calculating our gross revenue, we are looking at about seeing 15 patients a day per PNP. And if you multiply that at $85 an hour, you will get $1,275. And if you multiply that by 2, because there will be 2 PNP seeing patients, you will get about $2,550. And now we're going to put it together for the whole year. So we are calculating for 48 weeks a year, excluding 5 weeks for holidays and vacation time. The total will be $612,000 per year. When you have your gross revenue of $612,000, you're going to subtract $236,000 for your PNP salaries. You're going to subtract $36,000 for your secretary. You're going to subtract $36,000 for your medical assistant. You're going to subtract $33,000 for your business manager. And then you have to also subtract what you're going to pay your physician to collaborate with you, which will be $25,000 an annual flat fee, and then $12,500 per PNP. And then you have to include your charts. Your physician's going to look at your charts and he's going to charge you about $15 for each chart. So we're looking at about 800 charts for our clinic. So we're going to add in $12,000. The other expenses include rent, utilities, advertising. We want people to come to our clinic, obviously. Malpractice insurance for our PNPs, cleaning fees. We want to have a very good clinic that patients feel comfortable coming in. It's clean, everything's maintained. Our taxes, our DEA, so that we can prescribe medications. In total, it all comes out to about $500,800. So our clinical savings would be $111,200. This is all going to benefit the clinic, and these are all just rough estimates. Obviously, when you open up your own clinic, prices are going to change, but this is a very good start to what you would want to see in your clinic expenses, and your business manager will also work with you to even out the numbers and see where we're paying a little more and where we're paying a little less. And then these are my references used for this PowerPoint. Thank you so much.